Crisis in symptom-based treatment. Modern health models have a fundamental flaw: the lack of a comprehensive evaluation. Essentially, evaluation means identifying the root cause, tracing the origin of the problem. When we treat only the symptom, the real issue remains hidden, which makes treatment longer and often ineffective. Let's consider a simple yet debilitating symptom like fatigue. To understand its true nature, we need to dive deeper. 2 paths to diagnosing fatigue. The first step in evaluation is timing. When did this fatigue start exactly? Generally, chronic fatigue is linked to 2 major scenarios. Sleep deprivation. You simply aren't getting enough sleep. Unrecovered sleep. You are sleeping but still feel tired upon waking. While the immediate cause may be insufficient sleep, inability to sleep properly itself signals a deeper metabolic or physical imbalance. We can't mask it with an energy drink or a sleeping pill. We must identify the underlying trigger, analyzing the root causes of insomnia, inability to sleep. Let's examine some key physical stresses that interfere with restorative sleep. The adrenal fatigue load, stress glands. The deepest cause of insomnia and fatigue is chronic stress. This often manifests as fatigue of the adrenal glands. An interesting clinical observation involves the long-term effects of nicotine cessation. Nicotine artificially dilates coronary arteries, giving a sense of relaxation and easier breathing. When smoking is abruptly stopped after many years, the heart struggles to adapt without this artificial support, which puts chronic strain on the cardiovascular system. I've seen cases where nicotine withdrawal alone created persistent stress, severely impacting sleep and depleting energy. B. Physical discomfort and hormonal disruptions. Sleep can also be affected by minor physical issues, such as chronic back or neck pain, which prevents the body from finding a comfortable position. Additionally, hormonal changes, especially in women, hot flashes, frequently interrupt sleep cycles. 3. Sleep apnea and hidden sinus connections. A common diagnosis like sleep apnea is often treated without addressing the root cause. In many cases, the underlying problem is chronic sinus inflammation. The key question is, why does the sinus inflammation occur? Multifactorial analysis of sinuses. We need to investigate the sticky mucosal linings and the source of inflammation. E. Liver gallbladder, vitamin A axis. Chronic inflammation is often related to a nutritional deficiency, particularly vitamin A. But the issue is not just lack of vitamins. The problem may be malabsorption. If the gallbladder isn't releasing enough bile, the body cannot digest and absorb vitamin A from food, regardless of how nutrient-rich the diet is. Cortisol, nervous weakness link. Another major factor is constant adrenal hyperactivity. Overworking adrenal glands produce excess cortisol hormone. Elevated cortisol weakens the nerves in the back of the neck, causing atrophy. Since these nerves regulate mucosal function, control is lost, leading to swollen sinuses. This explains why adrenal issues are closely linked to common sinusitis complaints. Clinical observation. Severe sinus inflammation is traditionally treated with steroids, which are actually synthetic forms of adrenal hormones, cortisol. This highlights the deep, often unrecognized connection between adrenal function and sinus health. 30. Role of allergies and potassium. The problem may also manifest as chronic allergies. The root question is, why do allergies occur? The answer often points to weakened adrenal glands. A direct dietary component may also contribute, usually tied to deficiencies in key vitamins or low potassium, often due to insufficient vegetable intake or diets that spike blood. Sugar, like refined carbohydrates,